Hello, everyone. Welcome to today's webinar on preparing for the situational judgment test, a critical component of the CAAKT exam. As young Australian GPs, understanding how to approach and succeed in the SJT is essential, as it plays a pivotal role in your career trajectory. Whether you are aiming for postgraduate specialty training in general practice or preparing for clinical practice, mastering the SJT can make all the difference. Let's take a detailed look at why SJT skills matter and how to approach this section of the exam. The SJT is designed to simulate real-world clinical and ethical scenarios, making it a crucial part of your training and assessment. Unlike traditional knowledge-based tests, the SJT goes beyond factual recall and evaluates how you apply ethical standards and decision-making skills in complex clinical situations. This section of the exam is not just about having the right answers, it's about demonstrating readiness for clinical and professional practice. It tests your ability to balance professional standards with patient safety in high-pressure situations where judgment and ethics play a significant role. Your performance on the SJT directly influences your job prospects and eligibility for GP specialty training. A high score can improve your chances of securing placements in your desired region, while also reflecting your preparedness to handle challenging and often ambiguous scenarios. The key elements assessed in the SJT include, but not limited to, decision making in ethical dilemmas, managing exhaustion or burnout while maintaining professionalism, applying your professional knowledge in real world situations, and a few more. We have discussed and we have a few more webinar video tutorials to discuss in depth about the various types of scenarios and questions you might come across in your SJT test. Now let's find out the best approach to the situational judgment tests. When you approach the SJT, it's important to remember that success requires a balance of empathy, professionalism, and patient safety. While factual knowledge is critical in clinical settings, the SJT primarily tests your ability to make decisions quickly and ethically. A few key strategies for approaching the SJT. Assess decision-making skills. You will be required to demonstrate judgment in situations that go beyond the textbook knowledge, assessing the practical applications of medical ethics. Prioritize patient safety and adherence to professional guidelines. Always align your answers with the core principle of protecting the patient's well-being and following established professional protocols. Recognize negatively framed questions. Be aware of questions that are intentionally framed to mislead or push you toward less optimal responses. Stay focused on your core values and principles. Effective time management and reading comprehension. With time constraints, it's important to read the questions carefully and quickly identify key phrases that will guide your response. Now, balance empathy with professionalism. The SJT will test your ability to manage delicate situations. Ensure you demonstrate both empathy and professional integrity in your decisions. The core competencies which are assessed in the SJT, some of them are mentioned here and discussed here, but there might be some which are not in this list. So make your own additional reading.